Today we're working with Corey. He has some radiculopathy going down his arm, and we found out that's probably from a disc herniation in his cervical spine. So he seems like a good fit for cervical traction. We did some tests, a compression and then distraction test, and that seemed to help. The distraction helped with his help centralize his symptoms. So we're gonna give it a try on traction. It's his first time today, so we're gonna do a little bit lighter treatment for a shorter length of time to see how it works for him, and then next time we'll bump it up maybe 20-30 pounds for 20 to probably about 20 minutes, and see how that works for him, and then hopefully when the pain dies down we can get him into more exercises and help heal the pain here. So some contraindications for this would be if he had any acute trauma or traumatic injuries to his neck, if he had recent or at any time if he had any disc surgery or any surgery done to his vertebrae. If his symptoms, like during the treatment, if his symptoms are peripheralizing instead of centralizing and coming out of the extremities, we're going to stop treatment because that's a contraindication. And those are the things I'll ask before we get started here. And I think we're good to go. So I'll grab that. We're working with, so Corey, let's have you lay down here. And basically what we're doing today, just kind of like we did with the tests, where we did that distraction and it helped make things feel a little bit better.
Mm-hmm.
We're going to do that same thing. We're just going to use a machine, so it'll happen for a longer period of time, hopefully get you a little bit more relief.
Okay.
And the idea is we're going to open up, so we talked about those discs in the spine.
Yeah.
We're going to try to spread those out a little bit and get some fluid in there, and that'll help ease up the pressure that we have on the nerves coming down your arms and stuff.
Gotcha.
Does that sound good to you?
Yeah, that's
All
great.
right. And at any time, if things feel uncomfortable, I'll hand you this button here, and I just want you to stop the machine. If things are kind of getting worse in the arms, or if they're not coming out of the arm,
Mm-hmm.
same thing. We got to stop it, and we'll find a different way to deal with it. Okay.
Okay.
So I got a few questions first, just to ask you.
Gotcha.
Have you had any surgeries done to either the discs or anything done to your spine at all?
Nope.
Nope. And we talked about it a little in the interview, but I'll just double check. Have you had any sort of acute injury or anything that you remember that this specifically got worse, or maybe you had to go get help for or something?
No, not
No,
necessarily.
just kind of gradually got worse as
Yeah.
time goes on. Okay. And then the last thing, I just mentioned it, but we want to just make sure that the symptoms are coming back towards the spine. We don't want to keep them down in the arm as we do this procedure here.
Okay.
So, first thing I need to hand to you is we have this little stop button here, and I'm just going to have this. I want you to keep that in your hand the whole time.
Okay.
That's going to stop anything. If you have pain at all, if it feels wrong to you, if you have any hesitation with it, just press that. It'll ease off slowly, and then you can just relax there. When the treatment's over, I just want you to be a little bit more careful because we're kind of pulling things and loosening them up a little bit.
Okay.
So I just want you to be careful, make slow movements. We'll get up slowly, and we'll hang out for a little bit to make sure that we're not moving anything around that doesn't want to be moved. Okay?
Yeah, that's good.
All right. So what we're going to do here is we're just going to set you up and make you comfortable. I'm going to slide this from underneath you. And while you're laying down here, let's have you, can you lift up your knees real quick?
Yeah.
I'm just going to put a pillow under here to keep it nice and comfortable for you. How you feel?
It's good.
You good? All right. And I'm just going to put this towel over your forehead. And what we're doing with that is just a little bit extra protection between this pad here and your skin, just so things aren't uncomfortable. Does that feel all right there?
Yep.
Okay. I'm just going to tighten this down on you a little bit. All right, let's give that a try. Does that feel okay on your head?
Yeah.
Okay. And then the other thing, we just want to check where this pad is underneath the back of your head. Does that feel fairly comfortable there?
Yeah.
It feels
Fine.
pretty good. All right. So let's start there. I'm going to hook this up down here to the device that actually pulls. All right, so now he's hooked up, and we're gonna come over to the screen here. We're gonna go to traction. We're doing cervical traction today because we're doing a disc for a herniated disc. It's gonna be the anterior protocol. We'll just do manual so we can set it up how we want. We're gonna bump the time down because it's his first time. We're just gonna do 10 minutes to see how he feels. We have this the angle at 25 degrees. We want to stick between 20 and 30, so we're sitting at a good spot there. For the progressive steps, this will just bump up the intensity. Because it's his first time, we're going to do it manually to make sure he's doing all right. We keep control over the machine here. We'll set 3 regressive steps, so when the treatment is over, it slowly lets off the pressure instead of all coming off at once. It makes it a little bit more comfortable. Again, because this is a disc treatment, we're going to do static. That's been shown to have more of an effect on the discs compared to doing intermittent treatment. So we're all done there. We've got 10 minutes, and we're good to go there. And then, Corey, are you ready to go? Do you have questions at all?
No, I think we're good.
All right. So what we're going to do here is we're going to start bumping it up because it's his first time. We're going to go slow, and we'll just do somewhere between 7 to 10 pounds. And we'll see where we're at here. Do you feel a little bit pulled there?
Just barely.
Just barely? Alright, we'll bump it up a little bit. So there's 8. Let's try 10. Do you feel a little pull there?
Yeah, there we go.
Okay. So we're going to hit start there. And we're just going to hang out. And again, because it's his first time, I'm going to hang out with him for a little bit to see how the traction feels and if it's helping his symptoms at all. How does that feel for you, Corey?
It's good. Yeah,
That's good?
I can feel that kind of releasing some of the pressure in my neck, and it feels good.
Awesome. Alright, so just for this video, we're going to stop this here. And it's going to slowly let off the pressure there. Alright. How'd the treatment feel today, Corey?
It was good.
Did the symptoms kind of come up in from
your
arm up into the neck?
Didn't feel it as much down into my arms, so that was good.
Awesome. So I think this worked out well today. And I think we're going to try it. We're going to do a little bit more progressive next time.
Okay.
I'll just get this off of you here, and I can take that button back from you.
Yeah.
Awesome. And I'll just have you hang out there just for a second while things adjust a little bit, and then we'll get up and we'll send you out of here. But yeah, I think next treatment, if things centralized and I think things went well, so we'll bump up the weight a little bit more, and then we'll do a little bit longer time to get you a little bit more benefit out of it.
Awesome.
All right.